One thing that is fairly unique about our program is the fact that it was co-founded by a surgeon and a hepatologist, and for over 20 years has been co-managed by a surgeon and a hepatologist. Since the program began in 1985, we've performed more than 500 pediatric liver transplants. Here in Cincinnati, we see the range of all ages, income levels of all types, races, ethnicities of children and families.
Credit has to be given to what Dr. Balstrey and Reichman achieved. When they first began this process, they were seeing babies die from a failing liver in the first couple of years of life. The goal of the program has evolved to not just short-term survival, but now having a survival that goes well beyond, or gives a patient a chance to have a regular life.
I was immediately placed on the waiting list and at status 1A, and then I received a liver the very next day. They're almost like my family. I've been with the doctors here for about half of my life. Liver transplant's a long process. They say that the first year is kind of like a roller coaster, and I definitely experienced that. But after that first year, everything was pretty set. I was getting back into sports. I started going out with my friends more often. Cincinnati Children pushes you to get back to what you want to do.
Joanne and Dr. B and the nurses, and it's always the same people. They've been the same people for 10 years. Our pediatrician said the best doctor in the country is in Cincinnati Children's. And so we researched, we looked at Boston, we looked at Philadelphia, but we had to make a quick decision, and from everything we had heard, this was the place to be.
We take care of children from days old up until 18 plus years old for every liver condition that you can imagine that would require transplantation as a therapy.
Our program is very much a multidisciplinary program. Any patient who faces a challenge, you'll have both transplant and hepatology expertise on rounds making the decision for the patient. Really, with the research that's going on, if we could figure out the pathogenesis of some of these disease processes and alter their course so that patients don't ever have to be transplanted, we'd be doing them a favor. The likelihood of that happening in the near term is still a challenge, so we have to provide the optimal care.
Without Cincinnati Children's, I probably wouldn't be alive today. I definitely would not have the positive outlook on life.
It's an amazing experience to see a child go from very ill, just feeling awful all the time, and within a month of transplantation be a completely different child.